Welcome back to the Echo Pod. I'm Quincell from the Echo team, and I have.
Hello, everyone. My name is Dr. Freddie Rere. I'm a critical care pharmacist. I work in neurotrauma critical care as well as medical, surgical, and COVID ICU units. I am also on YouTube, Instagram, and TikTok under the name TraumaCistRx, and I just help with improving patients' health literacy.
Awesome. And today's topic, we'll be talking about updates on COVID and basically the COVID pandemic timeline.
Today, just to add on to that, we're going to talk about one of the big topics that probably towards the end of our podcast about Gavin Newsom and Biden's plans to lift the pandemic status, I guess, but we'll get to that in a little bit. So enjoy the podcast and thanks for tuning in.
Yes. So, did you want to dive deep into what the current climate is like for COVID?
Yeah. So if you're joining us, listening to us later, we're recording around end of January. And right now, the major strain is XBB 1.5, which is the daughter or son strain of the BA2 variant from Omicron. So Omicron, remember, was the one from November 2021 and really kind of wreaked havoc in 2022. Well, the BA2 variant of that had a baby, and that's XBB 1.5, also known as the Kraken variant.
Yeah, what is that? What is Kraken?
So, if you don't know what a kraken is, it's like a mythological sea monster, like a giant squid or something, and that terrorized pirates and ship owners back in the day, and used for like scary stories. And so the reason why XBB 1.5 is named the Kraken, not necessarily because XBB 1.5 is more scarier, but because some scientists found that naming some of the strains under mythological creatures was a lot easier to remember.
Oh, okay.
So XB, for everyone just kind of listening in, the Kraken variant is getting a lot of like headlines, oh my gosh, the Kraken variant, you better like mask up. But to be honest, with the XBB 1.5 variant, it's the same thing as the Omicron strains we've had. The symptoms are not more severe. They're pretty much the same. If anything, there's less risk of taste and smell, although some people still can lose their taste and smell. But overall, it's pretty much the same risk factors, same outcomes. As long as you get your vaccines and are boosted, you should be totally fine.
So it's not as bad as what we went through with Delta, right?
Correct, yeah. So, well, semi-correct. With Delta, that was a really big change in our like COVID infections, the surge and all of that. But with this strain, the things to be worried about is that it's way more infectious, but it doesn't cause as severe of an infection as maybe like Delta.
Okay, so it's not as virulent compared to
Yes,
the
but it's more
past.
contagious.
More contagious.
More contagious.
Okay.
So if you remember back in the day, back in March 2020, when you had to be unmasked and within 6 feet of someone
Yeah.
for 15 minutes to be
6 plus feet.
6+ feet to get infected with COVID, it's more likely because XBB 1.5 can grab onto your cells or the ACE2 receptor, your cells much more stronger, that it can infect people with maybe just a cough or just like walking by, or you're on a plane next to someone with COVID and you probably might be more at risk of getting it.
Okay, that's why like I caught COVID for the first time this winter season. And yeah, I'm pretty sure I got that strain because when I was on the plane and then I was like around family members for the holidays. So
Yeah, so super easy to get. So I would not be surprised if for those who get COVID XBB 1.5 between the beginning of January 2023 all the way through March 2023, it is this strain, and they're just passing by someone who had COVID.
Yeah.
So just kind of remember like our timelines, like test within 5 to 10 days. Stay home if you have symptoms and that sort of thing. You'll be totally fine. I do want to highlight some of the other differences with XBB. So we know vaccines work. Make sure to get your bivalent if it's been at least 2 months after your infection or 2 months after your last dose. So for me, I got COVID back in October 2022, and I still haven't gotten my bivalent, but I'll probably get it soon. It's been almost like 6 months or 4 months or so. So I'm due for that. So vaccines haven't changed. So with this new Kraken strain, you're still protected, especially the bivalent. booster. A lot of data is showing that less hospitalizations are occurring in elderly patients. So if you have an elderly patient, so if we talk about multi-generational households, right? You want to make sure that everyone in the household, especially the high-risk patients, especially your elderly grandparents, titos, titas, lolos, lulas, are all getting the bivalent booster to stay out of the hospital. Some other things that are changing, though, with this Kraken variant is the treatments. So we've stressed a lot about treatments, right? So Paxlovid is one that works. Molnupiravir is so-so, but I think people are still getting molnupiravir. The things that we do not know, or the things that we do know that do not work for this variant are monoclonal antibodies. So before, we used to have things like Regeneron, bebtelovimab, which are things where patients with COVID infections can go to the hospital and get. We no longer have monoclonal antibodies to protect against XBB. So,
So it's basically the biggest thing you could do is stay up to date with your vaccines.
correct. Yeah. So the main idea or the main point that we're trying to get to with this new variant is stay up to date with your vaccines, because that's honestly going to be the biggest thing to protect you. I mean, if you do get COVID, unfortunately, the only treatment you can get would be Paxlovid. And so, and with Paxlovid, we know that there are a lot of different drug-drug interactions too. So it's not as easy as getting Tamiflu or some other, OTC medication, Tylenol or anything like that. But if you're someone who takes a lot of other medications, like blood pressure medications, diabetes medications.
I heard it can also affect your kidneys.
Yes, that's another thing too. If you have kidney issues, we have to dose the medication like at a lower dose.
Oh, okay.
So all these sorts of issues can be complicated if your only treatment is Paxlovid. So if you're listening to this podcast or you know somebody who has multiple comorbidities, so like we mentioned in previous episodes, hypertension, diabetes, even antidepressants, and you'll hear in another episode, we'll talk about mental health. But patients who have those sorts of medications, antidepressants, anxiety medications, blood pressure, blood thinners, that sort of thing, they might find that there's some interactions with their Paxlovid. So again, those patients should always try to stay up to date with the vaccines.
Okay, that's why I see some ER providers who are hesitant to prescribe Paxlovid if their patient has many medical comorbidities.
Exactly.
And that's why they really emphasize have you gotten your booster?
Good.
How many doses do you have? It's really important for you to do that because otherwise you'll have a lot of drug reactions with your other.
Exactly. So, and the thing is, if you're about to be hospitalized for COVID, you kind of have no choice but to take Paxlovid. Otherwise, your symptoms might get worse. But the thing is, it means we might have to stop some important medications for some patients. And so that's the struggle that healthcare professionals are currently going through.
Does the risk outweigh the benefit?
Yeah, does the risk outweigh the benefits sort of thing, which we talk about a lot. But yeah, so it's challenging not just for patients, but also for healthcare providers to provide the best care without messing up all the other things in the patient's life. So
it's definitely a case-by-case basis. And
exactly.
I've seen some patients also get remdesivir. Is that still a thing?
Yes. Yeah, remdesivir is definitely still a treatment we're using. I don't really know the updated data on its efficacy with this new strain, but it seems, we use it in patients in-house all the time, who are hospitalized all the time still.
Okay.
So I would expect that that's still something that works. I haven't seen anything different. I haven't seen these patients get worse. And we're actually doing a shorter course. So for those of you who are interested in the medical point of view, we used to do a 5-day course of remdesivir. And for a lot of patients, they only require a 3-day course. So it's a shorter hospital stay or shorter treatment.
And then after you're hospitalized, what is the plan after?
Yeah, so after you're hospitalized, mainly it's kind of just following up. If you have any pulmonary or lung issues, following up with your pulmonologist, who you'll be assigned a lung doctor at discharge. Hey, follow up with this lung doctor after discharge. Or if you have other issues, you'll probably get more resources in managing your diabetes, hypertension, and all that stuff. And The thing is that with COVID, and even though we're transitioning towards not being such like a pandemic state, there's still a lot of complications that we've highlighted through the years and are still discovering. Patients who might develop clots from COVID is still a thing. So if you can imagine someone who got COVID, went to the hospital, were on a breathing machine, and then got clots, and now they're on this anticoagulant or blood thinning medication for many months. Now that gets this, then now that has to be managed by somebody else, outpatient too. So that's usually the plan. For most people who are fully vaccinated and do get some sort of minor hospitalization, it's probably just a follow up with your primary caregiver. But really, it depends on your complications.
Yeah, so you would go to like either pulmonologist or cardiologist, depending on what symptoms you experienced during COVID.
Or like even pharmacist-driven clinics that do some of this stuff too. So it really depends. I guess my question to you, as someone who sees the ED patients, what do you see in terms of patients who come in with COVID or flu or RSV, and do they get discharged from there a lot, or is it a lot of times they get admitted, or what do you usually see?
Lately, I've been seeing more milder symptoms compared to like the Delta and what we went through like 2 or 3 years ago. It's not like that anymore, and to me, I'm hopeful that it'll get better as we get like herd immunity and like increase in vaccine rates. So that's why like the ECHO team really emphasizes getting vaccines and staying up to date, because yeah, I do see the benefit in it, and there's not as much hospitalizations. And for people who have experienced like long COVID or like long-term symptoms of COVID, there are like treatment plans outside of being like seen in the ER for you to seek care.
Good.
Like short course of like albuterol if you have shortness of breath, and then like symptomatic treatments of using a humidifier at home, or using like guafenicine, like in the over-the-counter cough stuff.
Right.
So like it's pretty mild from what I've seen, but for folks that do get hospitalized, it's usually because either they're not up to date with their vaccines, or they have like super high risk factors.
Exactly. So you bring up a good point. I think as we're, again, like kind of moving forward from the pandemic, one of the things that's confusing is like, should everybody get boosters, which the current recommendation is yes, and I agree with that. But the patient population we're not really focusing on, even though we should, is like our high risk patients. So I think currently it's about 60% of elderly, like age 65 and over, have gotten their boosters. So there's still a large chunk of patients who haven't gotten their boosters. And we do know that it decreases hospitalization for these patients. So you definitely, if you know someone who hasn't gotten their booster, they're age 65 and older, or have like immunocompromised issues, history of cancer, that sort of thing, definitely want to highlight that getting your booster sooner than later is probably a good thing. And we'll also talk about a reason why you should get your vaccine sooner in the kind of like towards the end of our podcast. But one thing I wanted to mention before we moved on to the second topic is if you're someone who was immunocompromised, or had cancer or something like that, there was a drug that you could have taken to prevent COVID called Evusheld. Unfortunately, this sort of monoclonal antibody that protects patients, in addition to vaccines, no longer works against XBB 1.5. So
that's another one that's not.
It's
being
another
offered
one
anymore.
that's not being offered, and also you put this whole group of patients at risk of getting more COVID infection because they're not having extra protection.
So that wasn't as effective as it was before, like
So
Evusheld?
before, Evusheld was pretty helpful in, I guess, preventing COVID infection, but because we can't use it anymore, that's like one less thing we can do to help protect our patients. Yeah. So again, as we talk about moving on from the pandemic, yes, we're moving on, but we can't leave behind a large group of people, which it kind of feels like we may or may not be doing.
Yeah. And especially with what we went through with the winter surge, like with the RSV, flu, and COVID, like all of those viral infections manifest similar symptoms. So to know like what you have, it's kind of difficult.
Yeah, I do want to mention. So, out of curiosity, when I was working like a couple months ago with the RSV flu COVID situation, there was definitely a lot of flu and RSV flying around everywhere. A lot of
Yeah.
patients had it, in addition to COVID. But surprisingly, maybe or maybe not, this year I think COVID kind of took a back seat,
Yeah.
which is kind of funny. But that to me that worries some people in that not everyone has gotten COVID XBB 1.5. So maybe we're just kind of prolonging our surge. But I don't know. That's I'm kind of still like up in the air.
Yeah.
I do think that we are at the end of January, somewhat past like the triple demic. Is that what you see?
Yeah, I think it's calmed down a bit, but I think during the holidays it really spiked up because everyone's in close proximity.
Right.
Mask mandates have been lifted, so
Right.
more people have gotten upper respiratory infections and viral infections, but it's not as severe as what we've seen in the past.
Oh, okay, good. Yeah, same. I think that we were really, really busy up until this point
Yeah.
with other respiratory diseases, but now it's kind of calming down, hopefully, and hopefully we stay that way. I know that with recent travel and the new year, like Chinese New Year and all that stuff like that, there are some people saying that's a higher risk of causing another surge. So we'll see. Currently, XBB is 50% of the infections in the United States, probably slightly higher as of this recording, but just something to keep in mind that it's still really contagious.
Yeah, I know other countries have gone on lockdown again, or it's been a talk, but do you know if, like with the US, if we're gonna go on another lockdown, or what are the
Yeah.
new updates on that with the state of
So
emergency?
I don't expect us to go into another lockdown, and that kind of brings us to like our second point, which is a lot of so here in California, Governor Newsom has or mentioned at the end of last year that they're planning to remove our state of emergency for COVID and instead implement something else, and we'll talk about that in a second. In addition, President Biden also mentioned uplifting the COVID emergencies or COVID as an emergency. Is that what it was?
I think so, yeah, but
By
in May.
in May. So you have two different deadlines that are happening, and what does that mean, right? So we talk a lot about lockdowns and all of that stuff. I don't think that's ever coming back again, and we also know that that was somewhat harmful to like our students and businesses
Everyone.
and stuff like that. But it was helpful at the time. I mean, we didn't know much, and hindsight's 2020 in a way. But now that we have vaccines at least and some treatments, the issue or the thing with having COVID be an emergency isn't really like super important. But I would say that I'm kind of iffy on lifting COVID as an emergency. Like, what are your thoughts?
Because once we announced that, at least for California on February 28th, 2023, because we're recording this before
Yeah.
Newsom announces that, I think there will be like less resources available for the community.
Yeah.
And yeah, just like a disproportionate amount of resources being dispersed to different populations, which
Yeah.
could increase like fear and worry and just more feeling like you're isolated, because if you can't afford it, then like how are you going to seek the treatment?
Yeah, no, that's a
So,
good point. I think one of the things that was mentioned in the article for Biden's thing, at least, is so the government has been funding a lot of treatments, vaccines, checkups, laboratories to do COVID testing solely like for COVID. But with the emergency and state of emergency stuff kind of being lifted, like where do these resources go, right? So state of emergency usually is when resources are pushed to certain things. But with the state of emergency in California being lifted, one thing that kind of makes me hopeful is that even though we're removing the label of state of emergency for COVID, one thing that Governor Newsom and the team are, I guess, proposing is something called like the smarter plan. And so let me just pull up my notes here. So the smarter plan is supposed to be something that will replace the state of emergency for COVID and kind of like make COVID part of the California government's daily tasks, I guess. So the
So
smarter,
there is a plan.
There is a plan apparently. The SMARTER acronym stands for S is shot, so making sure that we have our vaccines available still. M, mask, so mask for people who need it and for respiratory viruses, including COVID. Awareness, so continuing to spread awareness about COVID, tracking variants, communicating clearly how people should protect themselves, and coordinate our state and local government response. So I think that's like an important one.
Yeah, Echo Team is really
Echo
good about
Echo Team is part of it.
raising
There's like,
awareness.
helping raise awareness, and we're just kind of helping that process.
Yeah.
But that will help with, in case there is a variant out there that is actually scary, like a Kraken, that avoids everything, we'll be prepared.
Yes.
Readiness, so COVID isn't going away, and they know that. So they need to be ready with tools, resources, and supplies to quickly respond to probably like an outbreak. So in case an outbreak happens again, like in Santa Clara when COVID first started, we're going to have a team there like ASAP, hopefully. Testing, so getting the right testing. Hopefully there'll be some testing sites that'll be solely for COVID, or at least testing supplies, because that was another big thing too.
Yeah.
Having a lack of testing supplies really harmed us at the beginning of the pandemic. So I think that they're focusing on that as well as education. So keeping schools open safely for in-person instruction, which is an important thing. And then R is evolving and improving treatments. Sorry, R is for RX. Evolving and improving treatments will become increasingly available and critical as a tool to save lives. So continuing to develop more treatments. So that
with
is
the ever evolving
with
variants.
Exactly. So
Mutants.
if you've been someone to follow kind of Echo Team and our IG lives and collaboration together, you know that variants are going to happen and continue to happen with COVID, because COVID's an mRNA virus and it likes to mutate, it likes to try new things.
But it doesn't alter your DNA.
Correct. Well, COVID doesn't, and also the vaccines don't.
Yeah.
Yes, correct. So at least I hope that this reassures those out there that even though we're lifting the state of emergency, it doesn't mean that California is abandoning COVID. It's still just kind of working in the back burner to develop more protection. So in case there is another surge or variant that, again, avoids everything, then we're ready for it. Or that's what I hope that this plan
and I think a lot of CBOs and also like local health jurisdictions, we're at a better state now. Like we know more about the virus, so that way like we can educate the community members on how to better prepare yourself if you do get infected or if you experience an outbreak.
Exactly.
So,
and even if like there are organizations that aren't able to reach you, there's other resources like Echo Team, Trauma Assist RX, and other things like that online that are already free.
yeah.
CDC, there's a lot of good things on there too.
World Health,
Exactly. So I kind of wanted to move a little bit more. So President Biden, like we just mentioned, it was removing the emergency of COVID-19. I don't know what plans he had or the government has from like a wide scale for every state. I don't know if that's going to be something that's going to happen. But one concern that was brought up and we're kind of like moving into is what happens to the people who can't afford COVID therapies, right? So if you've gotten a vaccine or treatment for COVID or even sick leave for COVID, it's all been paid for by the government because this is an emergency. So when the government kind of lifts the emergency, some of the downsides that may be projected to happen, I don't know what the plan will be after, but you might need to pay for COVID tests, which aren't cheap. Even now, if you go to CVS, like one test is like almost $10 or something.
Yeah,
Is it more than
when
that? I don't
I
know.
recently got COVID and my family ended up getting COVID too, we paid like $20 to $30 for 2 tests.
Oh my gosh.
And-
See?
Yeah, I was like, I wish we continually got free ones from the post office.
Yeah, so that's another thing too. If you have a family, you said 5 people in your household?
There's 4.
4. So just like an average household is like 4 people. You're going to need at least 2 to 3 tests in a 10-day period. So you test yourself initially at day 1 or 2, and then test yourself at like day 6. And then you need another test at day 10. That's 3 tests times 4. So that's 12 tests. And you said 2 tests was $20 to $30.
Yeah.
So 30 times 6, you're paying $180. Yeah, so that's crazy. that's one thing that can be at risk of being super expensive for people who get COVID. Vaccines, depending on what your insurance is, you might need to pay for vaccines. So that's why I think a lot of people, including myself and you and Echo Team, are primarily recommending getting vaccinated now.
Yeah.
One, you don't want to delay your risk for infection, and you want to improve your protection, as well as you want to avoid any extra cost. Yeah.
Yeah, we want.
5 minutes. That was cool.
Yeah, that was.
Anyways, and then lastly, all these disparities that we talk about with testing, vaccines, and treatments, that might cause more anxiety and stress, like you mentioned, for those who can't afford it, and even help like worsen these patients who do get COVID, like worsen their other disease states. So we talk about how COVID can worsen diabetes, hypertension, and all that stuff. But in this case, they can't get treatment. So now they're going to go to the hospital for multiple issues.
Yeah, and then now they're at risk for severe illness and
Exactly.
prolonged COVID symptoms. But I just wanted to plug that our county, San Joaquin County, is trying their best to like make sure COVID tests and vaccines are free and readily accessible to community members for as long as we can, beyond Biden's announcement of the pandemic being not a state of emergency anymore. So, and like being part of Echo Team, we want to have like more mobile clinics and testing sites readily accessible to our community that we serve, which is primarily South Stockton. So we want to create that accessibility and make sure everyone gets the amount of tests that they need for their multi-generational households. Right. Like some community members we've met, there's like 8 or 9 of them, and I'll just give them like 20, 30 tests. I'm like, here.
Because it's
like,
necessary.
Yeah.
Right? You want to stop the spread of infection, all that sort of stuff. So anyways, so kind of to wrap up, I guess, since we're pretty much towards the end of our podcast for today, COVID, we're kind of at that point where we're really starting to push away from being a pandemic, but that doesn't take away from what's still happening, and that new variants are happening. You still want to stay protected. You want to get the treatments that are available if they are available. Variants are still going to happen, but that's okay. We're going to continue to learn and stay protected. And also the last thing that you mentioned, like just look out for your resources out there, because things might get a little bit more challenging, but you want to stay prepared. So lastly, to kind of wrap it up, do we have any websites where people can look at resources off the top of your head? And if not, that's okay too.
For us, like we like to repost like journal articles or like credible peer-reviewed articles for like our Echo page. So it's at Echo Little Manila for our Instagram. And then like the other resources that we mentioned, like CDC, World Health.
Yeah, exactly. And is it covid.gov? I always forget what it is, but that's always still a good resource, or whitehouse.gov, or the COVID website. There's still free resources out there still today. And then lastly, if you want to learn more about COVID, we've talked a lot about that on my channel, Traumacist RX. There's still a lot of resources out there. I hope that this didn't scare anybody. But I think what we wanted to get out of this podcast is COVID's still evolving, and we're evolving with it, and we have a plan.
Yeah, and we should not let our attention wander and just let it fly out of our heads, because it's still here.
It's still here. COVID's still here, but we're prepared.
Yes.
Or we will be prepared.
We will continue to be educated and raise awareness for the community, so that way we could be better prepared for the future. Yeah.
Well, we hope that you enjoyed this episode. COVID updates and some of the things to look forward to for the beginning of 2023. Look out for the rest of our other Echo podcast episodes. Any last words, or we're pretty good?
We're good. Yeah. Do you want to plug in your Instagram?
Oh, yeah. So plug in one more time. My name's Freddie. I'm a critical care pharmacist. YouTube, IG, TikTok, Traumacist RX. And follow
at Echo Little Manila.
All right. Thanks for listening, and we'll see you in the next episode.
Bye.